So in Auricle, we have some core features as the first in which we have live class. So live classes is basically for the direct interaction of the faculty with the student. And also in Oracle, they are also we provide recorded session in which the student can have access or all the subjects anytime, anywhere through the recording sessions. Then also we provide notes that is with ultimative comprehensive book with CBME based question answers, MCQ and full zone full self-assessment. Then also MCQs are there from beginner level to expert level. Then you can also book a slot for personalized counseling session in which the student have the direct interaction with the counselor. Then we have some subscription plans starting from basic to premium. So the basic plan is of 3 months that's cost around 15,000, and the services are included are pre-recorded classes, live class, and quick revision examination module. In standard plan, which is of 6 months, the cost around 30,000. Services includes pre-recorded class, live doubt clarification, quick revision examination module. And the premium plan, which is of 12 months, which includes all the services that is provided by Oracle, like pre-recorded classes, live class, live dot clarification, one-to-one personalized guidance, notes, and quick revision examination module. So I would recommend all the students to take the premium plan. And also for 20% instant discount, you can use my code that is Aanchal20. So we are having the class over dialysis and diuretics. So first we're going to learn about the dialysis and artificial kidney. And this clinical case scenario we're going to discuss in the end of the session. So as we know, the dialysis is a procedure which aims to remove waste material and toxic substances and to store normal volume and composition of body fluids in fluid severe renal failure. So basically, whenever any person is suffering from the condition of the renal failure in which the kidney loses ability to purify blood or to constituent the unwanted substances inside the urine. So that's why those patient needs this procedure that is known as dialysis, in which there will be artificial removal of the toxic substances or the waste products out of the body, and this procedure is known as hemodialysis. Hemo means blood and dialysis means purification. So hemodialysis is the purification of blood outside the body. Now, what is the purpose? So the purpose of dialysis is to maintain fluid electrolyte and acid-base balance, and also to remove endogenous and exogenous toxins. So first, we should learn that who are those patients who basically needs this procedure. Why dialysis a need for them basically. So in this, first we're going to discuss some points about renal failure. So what is this renal failure? Renal failure is basically refers to the failure of excretory function of kidney. Right? So whenever any person is suffering from disorder, means that person has lose its ability to purify its own blood with the help of kidney, right? And it basically refers by characterized by decrease in GFR. Okay, so whenever the rate of GFR, the rate of filtrate will decrease, it directly indicates that the person is suffering from this disorder. Okay, so decrease in GFR is not much affected during the initial stage of renal failure. It is like 50% of the nephron are affected. GFR decreases only by 20 to 30% in the initial stage, but as the renal failure means the as the stages proceed, then at that time there will be means there will be severe effect in the rate of filtrate. Okay, so basically renal failure is also accompanied by other mechanism that is provided by our own body. means that that we have studied in the last class, that there was acidification of urine, there was acid base balance. So now we're going to learn that what are the different type of renal failure, in which we have first acute renal failure, and second we have chronic renal failure. So in acute renal failure, it refers to the condition in which there will be sudden stoppage of renal function. Acute means for a short period of time, but in this, it happens suddenly, sudden stoppage of renal function, right? And it is often reversible within few days to few weeks. And acute renal failure may result in sudden life-threatening reactions also inside the body, with the need for emergency treatments, right? Now, we should also learn that what are the various causes that are responsible for this acute renal failure. So in causes, the first we have is sorry. The first we have is pyelonephritis. Okay. Now, what is this pyelonephritis? As itis means inflammation. So, this is the inflammation of parenchyma of kidney and also the inflammation of lining of renal pelvis, which is caused by the presence of bacterial infection. Okay. And also this chronic inflammation leads to renal failure. Okay. And in this, second cause we have is renal ischemia. Now, what is this renal ischemia? Ischemia means inadequate blood supply to a part of body or an organ such as kidney, heart, brain, and it develops due to any kind of obstruction which is present inside the blood vessels, which is supplying to that particular organ. So always remember, ischemia means deficiency of blood supply. So whenever the term renal ischemia comes, so it directly indicates that there is a deficiency of blood supply in the kidney due to presence of any kind of obstructions inside the blood vessels. Then other reason, it can be due to damage to renal tissues. Okay, so by poisoning like lead, mercury, and carbon tetrachloride, there could be damage to renal tissue also, and that is also a cause of acute renal failure, right? So these all are the causes that basically responsible for the acute renal failure. Now, we should also learn that what are the features, means what are the signs and symptoms that will be shown by the person who is suffering from this condition, that is of acute renal failure. So the first feature could be oliguria. Oliguria means decrease in urinary output. Then another could be anuria. Anuria means cessation of urine formation in some cases. Okay. Then another could be proteinuria. Proteinuria means appearance of protein in urine like albuminuria, except albumin in urine. Okay. Another could be hematuria. Hematuria means presence of blood inside the urine. Then coma and death. Then in the condition of acidosis also, that we have discussed in detail in the last class, that acidosis is caused due to the retention of metabolic end products, right? So these are the all causes due to which this condition can be occurred, and these features include all the indication that is given by the patient who is suffering from this type of disorder. Okay, now next we have chronic failure. Chronic means for a long period of time. Okay, so chronic failure is the progressive, long-standing and irreversible impairment of renal function. Okay, so this is progressive, long-standing and irreversible. 99% time it remains irreversible always. Irreversible impairment of renal functions. Okay. Now, what are the causes which are responsible for this disease or for this condition? The causes includes like hypertension, it could be due to, in the case of kidney stone, that is known as renal calculi. Then urethral constriction could be the reason. Okay. And another thing is chronic glomerulonephritis. So in chronic renal disease, this is characterized by the long-term inflammation of kidney and also damage to glomerulus. So that condition is known as glomerulonephritis. Now, what are the features? Means what are the signs and symptoms that will be shown by the body of those patients who are suffering from chronic renal disorders? So it includes the condition of uremia. Uremia means it is a toxic condition which is also characterized by accumulation of end products of protein metabolism such as urea, nitrogen, creatinine inside the blood. Okay. Then another condition could be due to acidosis could be there. Then blood loss could be there. Anemia could be there. So in these conditions, when there will be complete failure of the renal function, means kidney will lose its ability to purify the blood. In those cases, the person will have the need of dialysis, or we call it purification, artificially purification of blood, that is known as hemodialysis. Okay. So as we have discussed, the need for display may be acute or chronic, as we have discussed in the previous slide. So the acute dialysis indicate when there is a high and rising level of serum potassium overload or impending pulmonary edema, increasing pericarditis, or any severe confusion if present, right? Then chronic or maintenance dialysis is indicated in chronic renal failure, that is known as end-stage renal disease. Now, what are the features of hemodialysis? Okay, that by hemodialysis, by artificially purification of blood, what can be the things that could be done? So basically, the hemodialysis cleanses the blood of accumulated waste product, removes the byproduct of protein metabolism such as urea, creatinine, and uric acid, then remove excessive fluids, maintain or restore the buffer system of the body, maintain or restore electrolytes level also. Okay, so these are the functions of the hemodialysis. Then next we have the procedure of hemodialysis. So as we can see, this is the diagram of the artificial kidney, and we can also call this procedure as hemodialysis. So in this, we have a dialyzer, then we have an inflow pressure monitor, then heparin pump is here. Heparin is used as an anticoagulant here. Then they are installing the fresh dialysate is here. Dialysate is basically a fluid which get filled inside this dialyzer. Then the saline solution is here. So we're going to discuss the mechanism that through which this whole process can be done. Okay. So as we know that dialysis refers to the diffusion of solute from an area of higher concentration to area of lower concentration through a semi-permeable membrane. And this indicates that this process occurred through the process of osmosis, in which there will be diffusion of solutes from higher area to lower area of concentration through a semi-permeable membrane. So means in here the osmosis process will be used. Okay, so basically what happened, patient arterial blood is passed continuously or intermittently through the artificial kidney and then back to the body through the vein. Okay, so first the blood will brought to this dialysis and after purification back to the body. Okay, now heparin here is used as an anticoagulant while passing the blood through the machine. So heparin, as we know, the heparin is a natural anticoagulant that is present inside the body also. So here in this machine also they are using heparin. Fine. Now, inside the artificial kidney, the blood passes through a dialyzer with this. Okay, inside the artificial kidney, the blood will pass through this dialyzer, and this is also known as hemofilter. Okay, and this contain minute channels, small channels are present which are interposed between two cellophane membranes. Okay, and these cellophane membranes are porous in nature and outer surface of these membrane is bathed in the dialyzing fluid known as dialysate. Okay, so as the fluid is which is present in this the dialyzer is dialysate. Also about its role in its composition we're going to cover in detail. Okay, now this dialysate in the artificial kidney is constantly replaced by the fresh dialysate. Okay, as we can see here the heparin is there which is used as an anticoagulant and the dialysate is using as basically the purifying agent. Okay. Now, which are those substances which need to extract out or excreted out from the blood? So those substances includes urea, creatinine, phosphate, and also other unwanted substances. Okay, so urea, creatinine, and phosphate, and also other unwanted substances from the blood passes to the dialysate by concentration gradient. The essential substances required by the body diffuse from dialysate into blood, and almost all the substances except plasma protein. Okay, all the substances except plasma protein are exchanged between the blood and dialysate through the cellophane membrane. Okay, so this is the function of cellophane membrane. Now, in addition to the dialysate, also the dialysis machine has several blood pump with pressure monitors also, which enable easy flow of blood from patient to the machine and back to the patient. Okay, so a pump is also present. That function is basically to enable easy flow of blood from patient to machine and back to patient blood, back to patient body. Okay, it also has pump for flow of fresh dialysate and for drainage of used dialysate, and total amount of blood in the dialysis machine at a time is about 500. Okay, so amount of blood at one time in machine is 500. Okay, the rate of blood flow through the dialysis machine is about 2 to 300 ml per minute. Okay, so the rate at which this purification is done inside this machine is 200 to 300 ml per minute. This is the rate. Okay, and the rate of dialysate flow is about 500 ml per minute. Okay, rate of dialysate is 500 ml per minute. Okay. Now, artificial kidney is the machine that is used to carry out dialysis during renal failure, and it is used to treat the patient suffering from the acute renal failure and the chronic or permanent renal failure, as we have already discussed. Okay, now what is the mechanism? So mechanism already we have discussed. So the term dialysis refers to the diffusion of solutes from higher concentration area to the lower concentration area through a semi-permeable membrane. Patient arterial blood is passed continuously or intermittently through the artificial kidney and then brought back to the body through the vein, and heparin here is used as an anticoagulant. Okay, while passing the blood through the machine. Now, what is the frequency and duration of dialysis basically? So basically frequency and dialysis will always depend upon the stage of renal failure, means the patient at which stage of renal failure. So the frequency and duration of dialysis depends upon the severity of renal dysfunction. Dialysis is done usually thrice a week in severe uremia. Okay, so if the person is suffering from the severe renal failure, so at that time it can be done 3 times in a week. Each time the artificial kidney is used for about 6 hours for the purification of blood. Now, what is this dialysate? Basically this dialysate is the dialyzing fluid that is used in kidney. Through this fluid, the blood is purified during dialysis. Okay, so this dialysate is a dialyzing fluid. Okay, now the concentration of various substances in the dialysate is adjusted in accordance with the need of the patient body. The fluid does not contain urea, urate, sulfate, phosphate, or creatinine. So these substances move from blood to the dialysis, and also because these substances are continuously present in this dialysis, so there is the necessity to replace this dialysis with the new dialysate. Okay, so this is the necessity that this old one in which these components are present should be replaced with the new dialysate. Okay, so what are the physiological principles? So the principle are osmosis that we have discussed. Other than the diffusion can be there, and process of ultrafiltration also could be used. Then we have the peritoneal dialysis. So what is peritoneal dialysis? So basically, this peritoneal dialysis is the technique in which peritoneal membrane is used as a semi-permeable membrane. Okay, so here this peritoneal membrane will use as a semi-permeable membrane, and it is also used to treat the patient suffering from renal failure. Okay, so what will be the procedure, how it can be done? So basically, this process is also done by inserting a catheter into the peritoneal cavity through the interior abdominal wall and then sutures. So our catheter will be inserted in the peritoneal cavity through interior abdominal wall. Then the suture will be there. The dialysate is the fluid that will be used for the purification. Now the dialysate is passed through the catheter under gravity. The required electrolyte from dialysate pass through vascular peritoneum into the blood vessel of abdominal cavity. Then those substances, the unwanted substances which are present like urea, creatinine, phosphate, and other unwanted substances diffuse from blood vessel into that fluid, the dialysis that we have used. Now later, dialysate is drained from peritoneal cavity by gravity. Okay, so dialysis also needed to be drained. That fluid need to come out. Okay, then the peritoneal dialysis. What are the advantage of this technique basically? Why this technique is preferable? Okay, so this dialysis is a simple, convenient, and less expensive technique compared to the hemodialysis. Patient themselves can change the fluid on and outpatient basis. But it also has some drawbacks. Okay, that it is less efficient in removing some of the toxic substances, and also it may lead to some kind of complication like infection. Okay, so as it has the advantages, also it has some disadvantages also, like less efficient to remove waste. Then second, chances of infection are there. Okay, then we have next, that is uremia. Now we're going to discuss what is uremia. So uremia is a toxic condition which is characterized by accumulation of end product. Okay, so this is the condition, toxic condition. in which there will be accumulation of end products of protein metabolism. And what are those products? Like urea, nitrogen, creatinine in blood. Okay. And there is also accumulation of other toxic substances also, like some organic acids and phenols. Okay. Now, the blood level of urea, nitrogen, and creatinine increasing during uremia, and toxic substances also, such as organic acids, phenols, also accumulated inside the blood, and artificial kidney can excrete more than double the amount of urea that could be excreted by the both the normal kidney. Okay, about 200 to 250 ml of plasma could be clear of urea per minute by the artificial kidney, but the urea clearance by kidney is only about 70 ml per minute. Okay. Now we have what are the other complications that could be occurred inside the patient body due to this process of dialysis. Okay, so the complication of dialysis depend upon the patient condition, like what is the existing age of the patient, what is the status of the renal failure, what is the severity of renal failure. So on these things also the complication can be depend, but the some common complication includes sleep disorder, anxiety, and depression. So these are the common disorders that can be found in the patient who are having basically who are taking this process, who are going through this process frequently. And then we have a MCQ. For that, you will get 30 seconds. Okay. What is the primary purpose of hemodialysis in patients with end-stage renal disease? And I know now all the student can give the answer. 30 seconds you are having. Yes, the answer is to remove waste products and excess fluid from the blood. Okay. Now, next we're going to start with the another topic, that is diuretics. Okay, so the diuretics or diuretic agent are those substances which enhance the urine formation. Okay, and output also. These substances increase the excretion of water, sodium, chloride through urine. Diuretic agents increase the urine by urine formation by influencing any of these processes involved in urine formation. So basically, these substances are used by those people who are having any kind of dysfunction in any segment of the kidney. Okay, so in those patients, the doctors recommend the use of these agents. Okay, and these diuretics are also known as water pills. Okay, now what are the general use of these diuretics? Means in which condition they can be used very frequently. Okay, so the diuretics are generally used for the treatment of disorders involving which involve in extracellular fluid volume, like in case of hypertension, congestive cardiac failure, and in case of edema. Okay, then diuretic agents prevent hypertension, congestive cardiac failure, and edema by increasing the urinary output and reducing extracellular fluid volume. So basically, in these conditions, there will be more and more accumulation of ECF inside the body. So by using these diuretics, there will be easy removal of the extracellular fluid volume by increasing the urine output. Now, what is the abuse and complication? So basically, in today's lifestyle, more people are using or abusing these substances for their own purposes, like the patient who want to do weight loss and other things. So there is also abuse of these substances also, which also create some kind of complication in their body. So nowadays diuretics are misused in order to reduce the body weight and keep the body slim. Even persons suffering from eating disorder attempt to reduce body weight by misusing diuretics. Now, prolonged use of these substances leads to complication like syndrome of diuretics dependent sodium retention, characterized by edema. Okay. The adverse effect depend upon the type of diuretic agent which is used by the person. Okay. Then what are the adverse effect that can be occur if the patient is misusing or abusing these substances? So that could be dehydration, electrolyte imbalance, headache, dizziness, renal damage, cardiac arrhythmia, and heart palpitation. These are the adverse effect that could be seen. Then we have the type of diuretics. Okay, so the type includes first osmotic diuretics, then diuretics with which inhibit active reabsorption of electrolytes, then which inhibit the action of aldosterone, then those diuretics which inhibit activity of carbonic anhydrase, then which increase glomerular filtration rate, and those diuretics which inhibit secretion of ADH, and the diuretics which inhibit ADH receptors. And one by one, we're going to discuss about all of them with examples. So first we have the osmotic diuretics. So the osmotic diuretics are the substance that induce osmotic diuresis. And osmotic diuresis is the type of diuresis that occurs because of increased osmotic pressure. So whenever there will be increased osmotic pressure, so at that time it can be use. Then some of the osmotic active substances that are not reabsorbed from renal tubule when injected in large quantity in the body, these substances increases the osmotic pressure in the tubular fluid which is present inside the kidney. Okay. Then in turn, water reduces reabsorption. It leads to excretion of excess of water through urine. Elevated blood sugar level in diabetes can also cause osmotic diuresis in the same manner. And in osmotic diuresis, the example includes are urea, mannitol, sucrose, and glucose. So these are the example of osmotic diuretics. Now, we're going to discuss the diuretics which inhibit active reabsorption of electrolyte. Okay, so diuretics of this type inhibits the active reabsorption of electrolyte like sodium, potassium from the renal tubule. And as we know, the active reabsorption of these substances mainly occur in PCT. Now, the inhibition of electrolyte reabsorption causes osmotic diuresis, and these agents are of three types. One by one, we're going to discuss them also. The first we have loop diuretics, the diuretic which inhibit electrolyte reabsorption in thick ascending limb of loop of Henle. So, loop diuretics are the substance which inhibit electrolyte reabsorption in Henle's loop, and these diuretic inhibit the sodium and chloride reabsorption from thick segment of ascending loop of Henle. So the osmotic pressure in the tubular fluid increases and ultimately leads to diuresis. The osmolarity of medullary interstitial fluid also decreases due to inhibition of sodium reabsorption into the medullary interstitium. So what will happen? Finally, the medullary interstitium fail to concentrate the urine and resulting in loss of excess fluid through urine. Okay, so in this way, these loop diuretics work, and the example we have are okay, these are the example of these loop diuretics. Now, the next we have diuretic which inhibit active transport of electrolyte in PCT, part of distal convoluted tubule. So diuretics of these type Okay, inhibit sodium reabsorption in PCT of the distal convoluted tubule, and these diuretics are usually called thiazide and related diuretics, and the example we have are chlorothiazide. Okay, so this is the example of these diuretics which inhibit active reabsorption of electrolyte in PCT of distal convoluted tubule. Okay, now next we have the diuretic which inhibit active transport of electrolyte in distal part of distal convoluted tubule and collecting duct. So basically, some of the diuretics inhibit reabsorption of sodium and excretion of potassium in distal portion of the distal convoluted tubule and collecting ducts. Such substances are known as potassium retaining diuretics and potassium sparing diuretics. And the example we have amyloride. Okay, so these are the example. Next, we have the diuretic which inhibit action of aldosterone. So some diuretic which inhibit sodium reabsorption and potassium excretion in the DCT and also from collecting duct by inhibiting the aldosterone. Okay, so their main aim to inhibit the action of this hormone, that is aldosterone. Now these substances are also known as potassium retaining diuretics and aldosterone antagonist. Okay, an example we have spironolactone and epinephrine. Now, next we have the diuretic which inhibit the activity of carbonic anhydrase. So, the some diuretic inhibit the activity of carbonic anhydrase, and carbonic anhydrase is the enzyme which is responsible for the splitting action of carbonic acid, right? So, in PCT and preventing reabsorption of bicarbonate, because whenever this enzyme is present, so there will be formation of bicarbonate in the presence of this. So, if bicarbonate will not form, so ultimately the reabsorption will also not take place. Okay, so such diuretics agents are known as carbonic anhydrase inhibitor. Okay, and the example we have is acetazolamide. Okay, this is the example. Okay, next we have the diuretic which inhibits secretion of antidiuretic hormone. So some diuretic produce diuresis by the inhibiting the secretion of this secretion of ADH. Okay, and in this example we have is water and we have ethanol. Okay. Then last we have the diuretic which inhibit antidiuretic hormone receptors. So the antagonist of V2 receptor, as we know the V2 receptors are present for the binding, which causes diuresis by inhibiting the receptor of antidiuretic hormone and thereby preventing the activity of this hormone. So this is all about the diuresis and the diuretics we have discussed. Now we have some questions and you have 30 seconds to answer. Which electrolyte abnormality is commonly associated with loop diuretic like furosemide? You have 30 seconds to answer. Yes, the answer is hypokalemia, and hypokalemia is the condition in which there will be low potassium level in blood. Okay. Okay. Now we have a clinical case scenario. Okay, so Mr. Smith is a 65-year-old male with a history of hypertension, diabetes mellitus, and chronic kidney disease stage 5, present to the emergency department with severe shortness of breath, bilateral leg swelling, and decreased urine output. He has been on thrice weekly hemodialysis for the past 2 years. Which medication is commonly used to manage fluid overload in CKD patients undergoing hemodialysis? And the options are there. Again, you have 30 seconds to answer. Yes, the answer is furosemide. As we know, this is a loop diuretic, right? As we have discussed, this is a loop diuretic which helps to remove excess fluid from the body by increasing the urine output. Okay, so this is the answer. So I hope all the students find this class helpful. And thank you so much. And also, if you have any kind of doubt, so you can connect with us with these platforms, social media platform. Thank you so much.